Hello everyone, this is Alraies from NCVH 2023 in New Orleans. I'm really privileged to be with the chairman of NCVH, Dr. Craig Walker, to talk about the mission and the main purpose of NCVH.
Sure. The mission of NCVH was to improve cardiovascular and specifically peripheral vascular care in our region and throughout the country. You know, we have an epidemic of peripheral arterial disease, and venous disease is the most common disorder faced. It's more common than coronary disease, peripheral disease, cancers all put together. Venous disease is so common. And certainly not enough attention paid to these problems, peripheral arterial disease and venous 100%. Disease. We wanted to educate others, A, about how big the problem is, but secondly, why it's important to make the diagnosis. Whether one is going to do an angioplasty or a stent or not. If we find peripheral arterial disease, we found a sick patient because those sick legs are almost never attached to a healthy patient. And these patients die of heart attacks and strokes, and these are preventable. Right. If we simply take these patients, lower their cholesterol, get them to quit smoking, take appropriate preventive measures, we can impact these patients. We can change their lives. That was the real purpose behind New Cardiovascular Horizons. We wanted to get this message out, and we are getting this message out. And people who have come here are seeing declining amputation rates, or seeing declining mortality rates with this, and are achieving much better success in treating their patients. Absolutely. That's our mission. Our mission wasn't to create a big meeting. Our mission was to help patients, and I'm excited. I get hundreds of letters each year and emails from patients, from physicians or other healthcare providers who've come to this meeting who have told me that it has changed what they can do for their patients. It's changed patients' lives, and that's the satisfaction that we get. That was the whole mission.
We are cardiologists. We always have some STEMI team, we have a PERT team, we have shock team, but we don't have PAD team. But when you came here, I saw the primary care, I saw the podiatrist, I saw the fellows, nurse, techs, and cardiologist and vascular surgeon together.
It takes a team. We cannot treat this whole disorder. Obviously, one of the missions of this meeting was to show that knowledge of the circulatory status of someone with an ulcer is important. You must know, is there a vein problem? Is there an arterial problem? And in many cases, you must fix that. But that's only a small part of the treatment. We have to heal the wound. We have to perhaps unload the foot. We have to treat an infection if it's there. We have to make sure if there's neuropathy that we cushion the foot. So there are many disciplines required to treat the whole patient. Absolutely. And our job here with New Cardiovascular Horizons is to create a welcoming, interdisciplinary team in a very congenial session. Absolutely. To discuss how do we do a better job.
Well, thank you, Dr. Walker, for all the effort you have done for 24 years, and next year going to be the 25th, which is a big milestone for the NCVH.
We can't wait. It's our silver anniversary, and we plan to have a nice party associated with that.
Thank you so much for all your effort and your team putting this together. And please watch these videos and others on the NCVH YouTube channel. This is Alraies from New Orleans. Dr. Walker, thanks so much.
Thank you.